Warm greetings. Today we're going to talk about a drug called Pantoprazole. So, if you're somebody who has a minimum of 10 medicines on a daily basis, I'm sure Pantoprazole is one of them, or even if it's not Pantoprazole, maybe one of its brothers. So, we will discuss all the details about the medicine from its use, indications, to possible side effects and interactions and warnings that you need to be aware of. Let's get started. Firstly, the what. So as we know, pantoprazole is the medicinal ingredient that comes as an oral tablet in doses of 20 and 40 mg. The most common brands are Sanis, Pantop, Pantoloc. Essentially, it's used to treat stomach acid related problems. And what problems? Let's discuss. Number one is ulcers. So if you have an ulcer in the stomach or in the duodenum, one of the most important medicines that is used to treat the ulcer is pantoprazole. Apart from that, if you have like a very common complaint that people come up with is heartburn, so that is basically reflux esophagitis or gastroesophageal reflux disease. Pantoprazole is also the recommended treatment for that. Apart from that, if you're taking certain medicines that are known to cause ulcers like NSAIDs, then this medicine is given as a precautionary measure to prevent any ulcers from forming. Okay. Apart from that, also in general, if you're taking like multiple medicines on a daily basis, medicines are bitter in nature. Like more often than not, they are bitter, and that's why they have the ability to irritate the gastrointestinal tract, thereby causing ulcers. So if there is an increased production of acid at that time, the probability of your ulcer forming is high. And that's why if people take like more than 5-6 drugs, this medicine is added just as a preventive measure, because it's one of the most safest medicines and it's better to prevent an ulcer than to treat it. So let's discuss the how. Pantoprazole is a proton pump inhibitor. It reduces the amount of acid your stomach makes. So if you already have an ulcer, we do not want more acid to be produced because that will cause more harm. So this medicine will reduce the production of acid, thereby reducing the severity of the disease. Right? Next, how to take. It's often prescribed once daily, and it's to be taken in the morning, preferably without food, like before breakfast. But if it's given twice also, like morning and evening, then again you can take it with or without food, but it's preferable to take without. Swallow it as a whole and do not crush or chew the tablet. Next, how to store the medicine. Room temperature, just protect it from light and keep away from children. How about I miss a dose? If you miss a dose, just take it as soon as you remember, and if it's almost time for the next dose, skip the missed dose, take the next dose at your regular time, but do not double it. If you ever have an accidental overdose, even if you are having no symptoms as such, it's always right to contact your healthcare professional immediately. Right? So now that we've discussed the how, let's move on to the side effects that this medicine has. Pantoprazole sodium is a well-tolerated medicine. It's given very commonly, and people take it for really long amount of time, like for years together. The most common adverse effects, even after such long treatment, have been really mild. So they can be anything from the most common ones, at least, being headache, diarrhea, or nausea. One thing you need to understand is withdrawal of this medicine. Like if you've taken it for a really long time, then if it has been withdrawn, there might be an aggravation of the symptoms. So you may have extra heartburn because suddenly a medicine that you took for so long has been stopped. But if you talk to your healthcare professional, it will be managed righteously. Okay. Next, the interactions associated with these drugs. As with most medicines, interactions with drugs are possible, but pantoprazole, they're relatively less. And always when you're talking to the doctor, make sure that you mention whatever vitamins you're taking, minerals, natural supplements, other medicines, or alternative homeopathic or Ayurvedic medicines. Specific to Pantoprazole, there are no drug-food interactions, but yeah, drug-drug interactions are there. So these 5 medicines, just keep them in mind if you're on one of them. Make sure you mention your professional and it'll be treated accordingly. So if you're on Warfarin, Atazanavir, Nelfinavir, Saquinavir, or Methotrexate, I mean, if you are on the medicine, you will know what it is for. So just remember the names. The warnings with this medicine is if you have any of these conditions, just make sure to mention it to the professional you are talking with, okay? So if you are pregnant or planning to become pregnant, it's not that it's harmful or anything, but just make sure they know, because they have to do a risk-benefit assessment to see if the patient has to be on this medicine. Is it absolutely necessary or can be avoided? If you're breastfeeding, or if you, along with your primary complaints, if you have any of these extra complaints, just make sure to mention it to your physician. That is unexplained weight loss, or diarrhea, repeated vomiting, or vomiting blood, or dark stools, difficulty in swallowing, or low magnesium or liver problems. This is specifically told because these medicines can probably mask the actual situation that's going on. So if you have dark stools, it may mean that there is another condition that has to be treated more aggressively than just the heartburn, and heartburn is just a side symptom. So that's why it's important that you mention every problem that you have to the physician, okay? You are not supposed to take Pantoprazole if you are allergic to the medicine itself or any of its ingredients, or if you're taking Rilpivirine, that's an antiretroviral medicine. If you're on that, your physician will not prescribe Pantoprazole, but make sure to mention that you are on this medicine, because you're absolutely not supposed to take with it. Lastly, a nerdy enough to take away, long-term use of proton pump inhibitors may interfere with the absorption of vitamin B12 from the diet. So this may cause like a shortage of B12 in your body, and you're supposed to just talk to your doctor about it. They will know, right? Apart from that, also vitamin D deficiency is seen, so maybe brittle bones, but that can be associated with aging as well. Just beware to mention for how long you are on the medicine. And that's it for today. I will be signing off. Yours sincerely, the Nerd.